everyone. So it is fall in New England. I'm Dr. Lee. This is Dr. Byrne with Root Family Medicine. And so it's cold and flu season. So we thought we'd have a fireside chat today since it's a little chilly out and just talk to you a little bit about what our favorite things to do for both prevention and at the first sign of a cold, and then to treat full-blown symptoms that you can do for yourself at home.
Mm-hmm. And just to remember, there's a lot you can do at home before you go to the doctor. When we're seeing patients, if they call us with symptoms, we'll help guide you in what symptoms to look for to go see your doctor. But there's actually a lot you can do yourself.
Yeah. So the main things for going to see your doctor for are respiratory distress. If you're wheezing and you can't breathe, obviously you need a doctor's visit. And then fevers. It depends on how high and how old the person is.
Especially, definitely if there's a baby under 2 months of age with a fever, that's a rectal temperature over 100.4. Or if there's a persistent fever that just won't go down. But really, really it's about how the child is acting. So if the kid looks sick or you have that feeling like something's not right, then definitely go. But if the child is a little bit irritable, fever's not too high, then we'll go over some things you can do.
Yeah, and basically, we're not big proponents of Tylenol and ibuprofen as soon as it's 100 degrees. Like, if your kid's miserable, then give them some pain reliever because they're miserable. But just to take down a fever is not always necessary. Like, maybe over 103, again, if they're just not feeling well. But otherwise, the fever's there to fight the bacteria or the virus. Let it do its work. And then for adults in particular, if you've had your symptoms 2 weeks or more and you are still getting worse, not better, or it's not getting better, then you definitely want to go in and see your doctor. You can ride it out for the first week or two and assume that. Support your immune system and assume it's going to do its job.
So we're going to talk about some preventive things you can do, and then as soon as you feel like you're getting symptoms, some other things you can do. So preventive-wise, really the whole thing is about keeping your immune system strong. So some of the more, straightforward things, even getting enough sleep. So if it's winter, there's a lot of germs swirling around. If you're sleep deprived, your immune system is going to be compromised. And then we think about healthy gut. So even for just, not getting sick during winter time, keeping your microbiome healthy, so you could do a probiotic every day. That would be a good wintertime supplement to do. This is just an example of one that we use a lot. And also vitamin D. So we know that in the wintertime, not as much sun exposure. A lot of people have low vitamin D, and that's a good one to take over the winter to keep your immune system strong.
And so things that we generally recommend, like at the first sign of a cold, or even if just there's a cold in your family and you've been in close contact, this V-Clear, which is pelargonium, also known as UMCA. Actually, the UMCA that you can get at CVS or at Whole Foods is the exact same product. It's a homeopathic pelargonium. First sign of a cold, it has good evidence for knocking that out and shortening the duration. If you're 5 days in, don't bother. Echinacea golden seal, again, this is just one that we carry in the office, but any good quality brand echinacea or golden seal is going to be really helpful at the first sign of a cold, boosts your immune system. And here's an Immune Zoom product, that's elderberry, that's got some good vitamin C. Elderberry is a little antiviral, anti-flu.
Mm-hmm. And this one tastes good, so that's
that
kind of a nice benefit. Elderberry is really yummy. And this is an elderberry and echinacea, so you can dose it also multiple times during the day. A product like this, if you just take it once, maybe you won't get as much oomph, but for something like this every few hours, if you dose it when you really feel like you're coming down with something, is useful.
And then things that, for other more specific things, you have a bad cough. This Clear Chest blend is nice. I like this one in particular, because it has both elderflower and elecampana in it. And those are two herbs that you don't often find in blends, but are both really good for your respiratory system. You can make your own cough syrup at home. If you're a do-it-yourselfer, highly recommend this book.
I love Dr. Low Dog.
And so what's the one that she has in here?
So she has a thyme cough syrup. Thyme is really a great herb for the respiratory tract. You can get it at the grocery store, so super easy. Pick up some, sprigs of fresh thyme. And she has a little recipe in here where you really, it's just water. Pour some water over the thyme. You're gonna let it infuse. You can add some honey. Even for kids, remember for under 12 months, you're gonna maybe use maple syrup instead of honey. But that's a great option as well.
And just honey has been shown to be as good as over-the-counter cough syrup for helping with cough symptoms. So just don't use it under 1 year old, but plain honey or honey with a little garlic or onion in it, steeped in it, actually is really good for you. And then this one we really like. If you're somebody who says, the minute I get a cold, I'm gonna get a sinus infection, this is a great Sinotrol. It's just got some really strong herbs in it, some N-acetylcysteine that helps you liquefy all that gunk and keep that viral cold, which you don't need to treat right away, into turning into a bacterial sinus infection, which is then that 10 days to 2 weeks not getting better, need to see the doctor.
Mm-hmm. And if you are someone who likes to do things yourself, elderberry syrup is actually pretty easy to make. This is elderberry, elderflower, and a cinnamon stick. And basically what I did to make this was just to add hot water over the elderberries and elderflowers and the cinnamon. Let it steep overnight, strain it, and then add some honey. And you can add brandy if you'd like to do that as well. But with just the honey, it's very yummy and works really well.
And you just take like a teaspoon of that 3 times a day.
Yep.
And then so there's some teas. These they're easily available from Whole Foods or grocery store. Traditional Medicinals is a great company. Again, not getting any money, but from them, we just like their stuff. And so this is a sampler, and it's got Gypsy Cold Care, Echinacea Plus, Throat Coat, Breathe Easy. Remember with these teas, what you want to do to get a medicinal level quality tea is steep it for 15-20 minutes covered, and then drink a cup of tea like 3 times a day. Mm-hmm. 1 cup of tea that's just been steeped 5 minutes is not really going to give you that medicinal level effect that you want. Mm-hmm. So that about sums up most of what we do for cough and cold, but rest, chicken soup, vitamin C, some herbs that just help boost your immune system. But don't think you can just, take your sinus care Advil and keep going to work.
Don't go to work.
Gonna get better.
Gotta stay home.
Don't do it. Stay home, rest.
It'll just
Rest
last
and
longer.
Chicken soup.
Yeah.
Grandma was right.
That's true.